So, Christine, first, I just want to thank you for agreeing to do this interview with me. You and I have had so many interactions through the Global Wellness Institute and the summits and press events and all that, but we've never had a chance to just sit down, you and I, and talk. So
I
it's
know it's
actually,
hard to believe.
I know
We've known each other a long time, and so this is great. Thank you for inviting me.
it's really a gift. And the focus of this conversation today is the Wellness Moonshot. As you know, it's been a very significant initiative from the Global Wellness Institute to create a world free of preventable disease. And at this point, it's touching 4,600 organizations and about 156 million people. So it's pretty exciting to see how much it's grown over the last 3 years. Every month we talk about a particular topic, and this month the topic is the word plan, the role of wellness planning in wellness leadership. There's so many ways we could talk about that word because obviously planning is essential. To achieve a goal, you have to create a plan, and then you start to set some strategies and take actions and all of that. But I wanted to talk to you about the word plan in a very particular way, and that is the role of planning in the earliest times of our life, early in the life cycle. Why does wellness planning matter then to prevent illness and disease as adults? Because my sense is we can go down, if we can go upstream, upstream, as far upstream as we can to the moment of conception
Mhm.
and start to really look at wellness then we start to prevent in a very significant way um, illness and disease. So thank you for being willing to do this. And I'll just kind of launch and ask you, what connections do you see? I know some of the science is saying it is so important, but what have you learned about that as far as the role of wellness in that earliest time of the life cycle?
Well, the science is very clear in showing us that preparing for pregnancy and actually having preconception health planning really helps to have a healthy pregnancy, then a healthy baby, and then a healthy toddler, and so on, into obviously growing into their adulthood. So some of the work that I learned actually was from an invitation to take some training with Dr. Pecorelli, first 1000 days of wellness. And what we learned in those programs was that preconception health really sets the roadmap for wellness for the rest of your life in terms of disease prevention. So if you actually plan your pregnancy in the same way that if you're going to plant a garden, you'll get the right tools, you'll get the right soil, you'll get the right seeds, and you'll prepare the garden before you plant your garden. It's the same with your body. If you prepare your body beforehand, and some of those things are very simple. They're like if you do smoke, that you quit smoking. If you drink alcohol, you either well, the ideal thing is to remove it altogether from your lifestyle, is to remove alcohol if you can, or certainly reduce it. And then we look to changing lifestyle habits such as eating, because we know that if you have diabetes before you get pregnant, the chances are of that continuing and maybe getting worse, and having gestational diabetes during pregnancy is a higher risk factor too. So if you prepare the body and the mind, of course, I always like to do that too. But if they can prepare the body for pregnancy, the outcomes are much, much better in terms of having a healthy baby and healthy child.
That's wonderful. So you're even taking it even farther before conception as to preparing yourself as someone who wants to have a child and saying, how do I support myself, my own health and well-being, so that I can create the conditions, me as an individual. And I would also add to that in whatever, if this child is coming through, or if this birth is coming through a partnership, having a healthy relationship I
Correct.
would think is pretty essential too to the level of health and stress that birth might be the conditions the birth might be within. So
Well, that's the
I'm not
key.
saying that very well, but
No, I know what you mean. And that's one of the things that they were able to track was cortisol levels and how that impacts the health of the baby when they're in utero. So if we can reduce cortisol levels by keeping blood pressure low and keeping the mom healthy, that's really helpful throughout the pregnancy. But to your point about preconception, we understand too that the importance of the male partner in the relationship is significant, and that 90 days prior to that sperm becoming part of your genetic material is really important. What the male was doing for 90 days prior, 3 months prior to that sperm becoming part of your baby, is really critical to also long-term health of the baby, the offspring that you would have. But the key thing is cortisol levels, and if you can keep those level, that's a really important aspect, again, for the couple that are going to have this baby and for the baby. So creating a well environment within the womb and then within the home is very important, because stress really impacts the baby. And then from a planning point of view, we plan for birth. Most couples will have a birthing plan, and they'll decide whether they want to have an epidural or not, an episiotomy or not, whether they want to have a C-section or not, if the baby's going to be breastfed. So you're planning from the very beginning. And the more we can plan for our children, the better it is for them, because even toddlers need a plan. They need to have routine. Children do well with a routine, specifically for eating and drinking and playtime, because if they have an expectation, then they're able to model their own behaviors around what they're seeing. If
Mm.
there's chaos in the household and there's no routine, it really gives the child a sense of, I guess, unknowing, because there's no real set plan as such. And I personally had to really learn about transitioning children from one thing to another, because my firstborn son had learning differences and he did not transition well. So I had to learn what the benefits of a plan and sticking to the plan,
Mhm.
because that wasn't necessarily easy for me. I came from a bit of a crazy Irish household where I was born and raised with 7 of us in one house. So for me, learning to be a mom that could plan and that could stick to the plan, I could understand the importance of how it impacted him and his behaviors, really was beneficial to me. And of course, now that I chair the Wellness for Children initiative, I'm able to draw on some of those personal experiences to say, actually, this is really a good, I think, thing to do. And of course, being part of the Global Wellness Institute gives you so much access to specialists and people who have been studying this for a long time. So we're able to cherry pick the data that we've been grateful to receive and to apply it then in some of our recommendations when we put wellness programs together for children and for parents, how best to really manage and plan your day for your child. Because if they're getting enough sleep and they're eating at the same time every day and they have playtime every day, and they know when it's homework time, for instance, for the older children, their body adjusts to that and their mind adjusts to that, because they know it's going to happen, and it really helps everybody to have a happier home, a less chaotic home, if everybody knows what they're supposed to be doing at any one time during the day.
That's wonderful. What everything you're describing all the way through the life cycle to me sounds like, how do we create an environment that is psychologically and physically safe and nurturing for this being's development and growth, and that may look different. There may be some principles like sleep, structure, good nutrition, movement and exercise. So there's some basics: not smoking, reducing or not drinking. Um, but I imagine, just like as you found with your own child, there are some differences as well, like really trying to understand that unique being as that
Yes.
being is growing, and what they need that might be a little bit different
Mhm.
than their brother or their sister,
Sure.
for them.
Well, we're seeing that with neurodiverse children, that we have to be flexible, but the one thing seems to be a common denominator, and that is having structure and routine.
Okay, I was going to ask you that. If there is a common denominator
Yeah.
across children, what are we finding? And that is
Yeah.
structure and routine. Okay.
Planning is the thing. If you can plan the day around, the best time the child will eat, this is their best time to eat, this is their best time for sleeping. For children who might have sensory issues, we know that some things work and some things don't, but having the plan to know exactly how the day will unfold, it always gives the child a sense of calm because they know what to expect. And it teaches them life skills too, like time management. They
Mm.
know how long it takes to do something if they're doing it the same time every day in the same way. So it helps them life skills for the rest of their life.
So, what gets in the way of us doing this? Because I think even as an adult, I think sometimes, um, I may want to achieve something, but I don't always get to the plan, and then I don't achieve it. So I'm wondering if planning is this important all the way through our lives, and really building this capacity to use planning as a tool to support kind of not only the structure you talk about, but a calmness in our nervous system that can lean into and rely on something. If we know this scientifically, and we actually know this experientially, we know this works, what gets in the way of that?
I would say in probably technology, if we're looking at what's happening right now, we get distracted. We get distracted with our phones or laptops or, devices. And what's happened a little bit, particularly because of COVID, is that parents found themselves as, parenting, caregivers, teacher, everything under one roof,
Mm,
and not really sure because they were never really given tools to be educators and to be at home with their child 24/7. Most parents had no idea what that looked like because their children had been in preschool and kindergarten since birth. So and if you were at home with three children of different ages with different expectations, it was really a struggle for parents.
mm,
So technology was given out much more freely than it usually would be, and probably the rules changed a lot. If you normally allowed your child to be on their tablet or their phone for an hour a day, now it might be 3 hours a day,
mhm.
and then they had to do homework online, and so they're doing homework and they're switching off the same way, which was not healthy,
Yeah.
and we know from circadian health, if you're looking at having a good sleep pattern, you can't have technology for at least an hour before sleep time.
Mhm.
So having again to instruct your child or to at least guide them into making a good choice for themselves before bed. We know that blue light impacts the brain and it doesn't lead to a good night's sleep. It's rather a broken sleep and not as restful as it could be if they've been playing a computer game or been online for an hour before bed. So the planning of bedtime is another important thing to do. And if they're very young, it's bath time and it's story time and it's cuddle time, and then they know it's sleep time.
Mm.
But because COVID really impacted children and families' family life, because there was no routine to go to school. You weren't getting up to get dressed. All of those things that we used to do was really impacted. So I think we're going to find ourselves starting from scratch all over again.
Mhm.
And what's our new normal? At the summit in Boston, we talked about this, the new wellness opportunities. But I think our children will benefit greatly if the parents can make the decision that we have to reintroduce plans again and structure again, because we're finding too as parents our working habits have changed too. Some companies don't want you back in the office. They're like, okay, great, we're not going to pay for buildings anymore, work from home. And
Right.
so we're trying to find our feet again. But I would say, as a word of advice, is absolutely find structure again. Find a new one, even if it's just morning. Your morning routine needs to go back to being something that everyone can agree upon. And then nighttime rituals, they need to come back into play. As I said, if it's not eating after 7 o'clock at night, maybe bath time, and as I said, reading time, but making sure that their children have some downtime from technology. I know we're looking at AI and the importance of tracking sleep and wearables and all of these new wonderful technologies we have to help with wellness. But for our younger children in particular, we're really seeing addiction to technology,
Mm,
unfortunately. And
mhm.
so if we look at that through the lens of mental health, we know that we have to start putting some real restrictions on children and their access to technology.
It strikes me that the focus on structure that you're mentioning, like just, okay, this is an opportunity to reset. COVID did bring about such dramatic disruption, for companies, for societies, but for our personal lives. It was
Yeah.
so incredibly disruptive. And that has so much stress that comes along with it. But what it also has is this opportunity to reset
Yep.
and to go, okay, now here's the role of planning. I'm going to take a step back and I'm going to say, what is the kind of life I want to create for myself, for my children, for my family? What is the kind of life I really want to create? And that can be what I found that can be a real reorientation of values, a recentering of kind of recentering the center of gravity in your life,
Right.
instead of it being quite as work focused, really
Mhm.
looking at the health and well-being of the family, your personal health and well-being. So I think there's also a gift in the pandemic that
Yes.
it is calling to attention this opportunity to reprioritize, and
Yeah.
relook at what's important to us. And the focus on structure, whether it was before COVID, as you mentioned, it was important, or now, finding that new structure that will support health and well being of the family, of your child as a priority. Um, it seems like that is not only a lesson to support children and children development, but that is one that every one of us can use for our own development and our own sense of calmness and a sense of inner security as the world continues to change. The world is not going to stop changing. The world is
No.
going to, in fact, it's likely going to accelerate through technology. There's going to be an acceleration of change. And we're seeing that occur. So all of us can learn how do I create that structure that enables me to thrive? So I'm just kind of cluing into what we're saying is really important for child development from the moment of conception is the same thing that's absolutely important for every one of us as throughout our life cycle. So thank you for kind of emphasizing that.
Yes.
I want to ask you a question about, I know you're leading the Wellness for Children initiative, and I wonder if you could just briefly give us a sense of what that initiative is about, because it sounds like many of the insights you're sharing right now are shared within that initiative and through some resources. And so tell us a little more about that.
Yeah, well, we've been very active really in the last couple of years to focus on the very little children. So from birth to 5 years of age. Now, obviously, we are using the UN's definition of a child, which is up to 19, but we felt because we had a unique access to 400 children at a private Montessori school in Ireland, which is my niece's school, that we could really bring in and create a wellness program, the first wellness preschool in Ireland. So that's what we decided we would do. And we have little ones, as I said, from birth up to 5 years of age before they go to big school, as we call it in Ireland, but elementary school, or kindergarten. But we decided that we wanted to look at what I call the five senses solution, which is really our senses and really engaging our senses every day, since our children have become so visual, that we would make sure that we had touch, taste, sight, sound, and smell, and that we would engage the children every day in those senses through activities from being outside. I mean, that game of I Spy, it doesn't get old. Certainly not for me, it doesn't. But if we can spy something with beginning with yellow, and we see a daffodil and then we smell it, but we just work with the simplest of things. And we wanted families to know it doesn't have to cost anything. It's some of the work we're doing is breath work. We're doing mindfulness techniques. We're doing massage on hands and feet. And we're working with the Massage Makes Me Happy and Healthy initiative. We're working with First 1000 Days initiative with the wonderful Elena Hernandez, and of course with Dr. Pecorelli and Patricia Lantz. So we've just had a wonderful collaboration of interest in this. And now, in fact, we're working with Mindstream with Freddie Morose, who was presented at the summit in Boston. And we're actually conducting a study on music as medicine. And we want to see specific types of music for specific durations, with different tempo and frequency and so on, to see how we can impact the mental health of children without medication, if it's possible to do that. So we're very fortunate to have been gifted some headsets, and we've got 150 children in the study between the ages of 2 and 5, and we're going to play music and check the outcomes. So we have music for focus, music for sleep, music for play, and music for meditation. So we want to see what the outcomes of that are. So keep an eye out, because we hope to have a white paper on that later in the summer.
That is very exciting, and it's exciting that you yourself, your team are birthing new insights about the power of wellness for children, and
Yeah,
that that
I'm
can
very
be used
excited about it.
beyond this school, that can really be used many other places. So
Well, we are very fortunate. And just one last thing. In fact, we're going to launch, we created a wellness at home collection. So again, for families, and we're launching that in Dubai next week. So I'll be in Dubai
wonderful.
meeting some of our favorite people over there too. So when we like to launch in the US next year, so fingers crossed for that. But when we have everything up and ready, it's not quite there yet, but there's a lot that we'd like to share on our website too, just simple techniques. We'll have a blog, a monthly blog, to talk about simple ways to introduce wellness at home that don't cost anything, because I truly believe wellness is for all, and it should be for everybody. And the some of the simple techniques are something we can do every day at any time of the day that we need. I mean, some day it's just as simple as doing some diaphragmatic breathing, or or 4-7-8, that we again were taught with Dr. Andrew Whale, who was part of our program, and who presented at one of the summits. I can't remember which one. I think the one at the Breakers.
It was
He
like
talked about that.
2017. Yeah, it was a while ago. Before, yeah, I
So
think so.
breath work, we know how important breath work is. Well, that's easy, and we can teach children. We do a high five breath work where the children breathe in and breathe out and breathe in and breathe out. And it's so simple, but they love it. And so turning these things, the thing then, of course, is making sure that the parents have time, or the caregiver has time to do this. But that's back to our planning. If you plan your meals and homework and nighttime routines, that you can say, for 5 minutes, we'll do some breath work and a little mindfulness, or I'll massage your feet, or I'll massage your hands. We're working with a wonderful Irish woman, I'm proud to say, Peggy Crowley, who's created a great line for families, um, a balm that is safe for children to use from birth up to and beyond. So we use these balms to do hand rituals and foot rituals with
Beautiful.
families, as part of their nighttime routine. So some of the things are just very simple but hugely effective, and we're happy to share them as much as we can.
I love it. And what I also love about it is I just thinking about, because I've done that breath practice before where you
Oh,
inhale and exhale and inhale and exhale. It's just a great practice. And when I think of it, when you think about guiding a child to do that, you realize it's also having an effect on you. So it's never just about the child. Everything you're talking about also supports this sense of co-regulation, and
yeah,
this as my heart rate moves at a certain rate, so does yours. Has your blood pressure lower, so does mine. As we both get calmer, we both get calmer, and we support others in getting calmer. So there's always this interdependence with any practice we do when it
yeah.
comes to wellness practices. So that's just really beautiful to think about children as the avenue for, a primary avenue for the prevention of illness and disease, but also for really enhancing our vitality and well-being, not just preventing illness and disease, but really enhancing our vitality across the planet. So I'm thrilled to have been able to talk to you, Christine, and
Oh, Renee, thank you for the opportunity to chat. I love this, and I'm just glad that we can talk about it. I'd talk about it all day long if I could. So
well,
thanks.
we will do this again. We will do this again. I promise you.
Okay, great. Thanks so much, Renee, for the invitation. Thanks.
You.